we start with so sharing the screen. Well, today we start the new unit of the book. This is Unit 3, Instructions and Procedures. And so I would like you to have a look at the slide and so it looks like we need to share it one more time. Can you see the slide full screen now? Hello?
Yes.
It's full. It is full screen, right?
Yes. Yes.
So now, well, first, I would like to say some words about your home assignment. So you remember that the task was to watch the video and to complete the gaps in the information in the text file. And so everything was right. I mean, so the students, I see that you've seen the episode, the video, the conversation between a nurse and the patient. There were some problems with maybe spelling or maybe understanding the symptoms that the patient was speaking about. Because I've found some mysterious phrases in students' papers, like in other symptoms line, the students wrote like soft throat, sauce food, sot thirot, so these kind of things. So the correct answer was sore throat. This is the symptom when just the patient feels pain in his throat. And so maybe the students didn't recognize this symptom. Maybe it's a new phrase. So that is why I didn't consider it to be a mistake. But so like in the first screen, but if we speak about the other papers, the other screens, it's not food, it's like throat. So this is the mistake, of course. Well, and so do you see the screens? Hello. Hello.
Yes.
Yes. Okay. Well, do you have any questions about the homework? No questions?
No, thank you.
Okay. So now we are going to speak about the instructions and procedures, and there are several pictures here. And well, in the pictures, there are people working in a hospital. And the question, what is happening in the pictures? And what do you think happens before and after this? What is shown in the pictures? Do you have any ideas? Yay. So I need to understand who is here. So the 22nd of February. Well, Marwan. Is Marwan here?
Marwan left the university.
Left the university, thank you. I see, okay. Mohammad Isam Wahish.
Yes.
You are here, okay. Ahmed. Abdelrahim Ahmed Khalid Mohammed. No, he's absent. Zena,
Yes,
Anna?
I'm here.
I see. Okay. Ala.
Yes, I'm here.
Mhm. Dilara.
I'm here.
Good. Bere.
I am here.
Ezginur.
I'm here.
Well, Buse. Is Buse here? Polat Buse. Absent. Mustafa Uçan
Here.
and Jiren. Jiren?
Here.
Okay. So, Mohammad Wahish. So what can you say about the first picture? What is happening in picture A?
I think a doctor wants to test the patient.
So he wants the patient to asks the patient to get just to lay down, right? Or to get
Yeah.
undressed for the examination. Mhm. Okay. So, well, in the next picture, picture B, Zena, what can you see here? Zena, hello, are you here? Zena? No.
Yes, doctor.
Yes. So what can you see in picture B, Zena? Zena?
I'm sorry for interrupting. Ahmed is saying that the electricity cut off in his house, so he cannot join. He doesn't have, like the router is not working and he can't charge his laptop.
I see. I
Do-
see. Okay.
Doctor, can you hear me?
Yes, now I can hear Zena. Yeah.
Yeah, it was lagging, sorry. I
Mhm.
opened my 4G. In picture B,
Yes, in picture B.
yeah, I think that the doctor is writing the information of the patient.
Mhm. So what do we call this information? So this form. Is it-
Maybe
Mhm.
patient, wait, it's not
it-
patient history, but patient something.
Case history, right? Yes, case history.
Sorry?
Case history. So we've seen
Oh.
such a form last class, case history, where there is information about presenting complaint, the family history, all kind of things. Okay,
Yes.
so yes, she's writing something maybe after she has examined the patient. So she is writing down some information about the patient. In picture C, what is happening here? Ala?
Yes.
So what do you think of this picture?
They're checking the patient.
And one of the doctors, the elder one, what is he doing?
I'm not sure, it's not really clear, but maybe he's checking the pulse or the breathing of the patient.
Mhm. And what do you think is he talking about? Why are the other doctors nearby?
Maybe he's explaining how to incubate or like
Okay.
how to check something, how to perform the correct way.
Yes, he's explaining and maybe he's teaching them how to do some kind of procedure. Yes,
Yeah.
and just maybe perhaps after these actions, he will ask the younger doctors to do the same procedure. Well,
Yeah, maybe he's evaluating them.
Okay. And so 3 more pictures here. The same question, what is happening? So in picture D, let us listen to Dilara. So where are the people? What are they doing?
Doctor is talking with a consultant,
Mhm.
and consultant may have asked the new doctor or junior doctor maybe a question about patients.
Okay, there are several people here. Just they're discussing the condition of the patient. And so this is the so-called ward round, when several doctors and nurses just go around the hospital and discuss the condition of patients in different wards, and what the patient prescribe some procedures to the patients. Well, in picture E, so let us listen to Bere. Bere, what can you see in picture E?
Doctor talk to nurse, I think.
Okay, yes, possible. So medical specialist, maybe one of them is a doctor, another is a nurse. So, okay, yes, they're discussing something important related to their job. Some medical case, maybe. Good. In picture F, where's Ginur? What do you think of picture F? Who are they? Patients, doctors, who are they, these people? You can see stethoscopes, right? So it means they are
Yes.
doctors, right?
Right.
One of the doctor is yawning, so he's tired. So when are people normally tired? Who can help us? So
What's
the
the
people.
question?
So one of the doctors here in picture F looks tired. When are the people tired? Are they tired at the beginning of their just shift or at the end of their workday? Yes.
Maybe he worked too long for the during his day. So at the end of the shift he's like at the end of the shift he got tired.
Yes, and maybe he is just transferring the information to talking to another a newcomer, a new doctor about his night shift or previous shift, just giving her some information about the patients. They're changing the shift. Okay, so these are the normal typical situation that happen in a hospital. And so let us look at the definition of a ward. So a ward is a separate room in a hospital, typically one allocated to a particular type of patient. So previously we were speaking about surgery or office, but this is the place where general practitioner just where the patients just come to see general practitioners. But this is a ward in a hospital. So like in picture D, for example, this is a ward. And so what is do you have any kind of experience in a ward have you ever been in a ward? And Now, what is your experience in a ward for the first time? So let us listen to Buse. Have you ever been in a ward, Buse? Is Buse here? Hello? No, minus. Mustafa, what about you? Yes.
Yes, I have been in a ward. So,
Yes,
what's
please.
the question?
Have you ever been in a ward, and when and why?
I think first time I have been in a ward was that my grandfather had heart attack,
Mhm,
and I gone to visit him.
mhm.
I think,
Okay.
and be there.
And how did you feel?
Actually, I didn't think much about the room. I mean,
Mhm.
my mind was busy.
I
I
see.
think
Yes, you were worried about your father, right? So,
grandfather.
grandfather, I see. And
Yes.
so did the people in the hospital help him?
Yeah, of course. They were checking all the time if he needs anything or is his condition getting worse or better. I think
Mhm. So they were rather professional, right?
yes.
Mhm. Okay. Okay, yes. When this is a very serious condition, when a patient gets into a hospital, that is why the people need to be focused. I mean, the doctors and nurses focused on the patient and need to be helpful and useful. And so, mhm. So ward round. So we've said about this. The ward round is a visit of a doctor in a hospital to each of the patients in a ward. Now, here are some tips for the first ward round. Why do you think each tip is given? Let us look through the tips and listen now to Jeren. Will you read the first tip? Jeren?
Make sure you know the names of your patients and where they are.
Why is it important? You as a doctor should know the names of patients and where they are located. Why is it important, Jeren?
I don't know.
Well, if you come to a ward, so if you make a ward round, so and you see there are some patients in the ward, so should you know their names and so what kind of conditions they have? Should you know this? Jeren?
Yes,
Yes. So it's important to get
yes, it's important.
the right information about, because you should you can have a look at the case history that is just each patient has, and just know about the condition of the patient. Okay, so the B tip, let us listen to Mohammad Wahesh. Mohammad, hello. So, what's wrong today? Zena, are you here?
Yes, I'm here.
So, will you read B, please?
Sorry. Find out from the bed managers if any patients have been moved and where.
Mhm.
So so the doctor can check up on him.
Mhm.
Like he needs to know where the patient is so he can check up on the patient in the ward round.
Mhm, mhm. You should know where the patients are. So just to,
Yeah, exactly. How could he? Yeah, exactly.
Okay, thank you. Now, Alia, what about tip C here? Read it, please, Alia. Alia?
Dr. Ala wrote you on WhatsApp a message that she can't enter.
Just a minute. Mhm. Mhm. I see, she's sick. Well, Dilara, will you read the C tip, please?
Check that all the case notes, investigation, and so on are on the ward. I think it's important for the doctors and medical establishments to properly maintain the records of patients for two important reasons. First is that it will help them in scientific evaluation of their patient profile.
Exactly.
And
Mhm.
second, helping in analyzing the treatment results and to plan treatment protocols. Yes,
Mhm.
that's all.
Okay, so perfect, thank you. Well, so what about the next one? This is D, and Bire, read it, please. Tip D.
Yes, invite a nurse who knows your patients to come on the ward rounds. It's a good to know about the patients.
Mhm.
Yes.
Why should doctors invite nurses? Why?
In the connect of ward rounds begin about in
Well, yes.
patients ask question on the ward rounds.
Mhm.
That's it.
I mean that, for example, if a doctor prescribes some procedures or medications to a patient, who will give these medications? Doctor himself or a nurse?
And nurse.
Nurse. So a nurse spends more time with the patients than a doctor. Maybe she knows some details about the condition of the patient and just help the doctor in making decisions. Okay.
Yes.
Mhm.
Okay.
And so thank you. And the next line is for Ezginur, please. Ezginur.
Yes, record case histories and results clearly and concisely.
Why should doctors do it clearly and concisely? Why?
The case presentation section should contain a description of the patient, relevant demographic information, any relevant medical history of the patients, the patient symptoms and signs, and tests that were carried out, and a description. That's all.
Mhm. Yes, just to help other people who is going to treat the patient to get the correct information about the patient. So because several doctors are involved in the treatment procedures. Mhm. Okay, good. And now we are going to listen to some information, and you can see they are discussing the reasons, the tips. And there are several phrases here on the slide, and we should listen and complete. So the reasons given for each tip. Use no more than 5 words for each gap. So now I'm going to turn the recording on, and you'll tell me if you can hear.
Unit 3, Listening 1.
Can you hear?
Yes, we can.
Yes, okay, now.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar.
Just a minute.
Give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
And now for the second time.
Unit 3, Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
Well, now, so what did we write in A line? So Mustafa. Mustafa, hello.
Hello.
Yes. So line A, what did you write here?
Make sure you know
Mhm.
names of patients,
Mhm.
all the patients, as you want to demonstrate you are familiar with them.
Exactly. Mhm. Good. So line B, Jiren, please. Jiren,
I'm sorry, I can't hear.
can't you see the slide? Do you see the slide, Jiren?
Yes, yes, I can see.
So, did you write anything in line B?
No.
No, you didn't. Well, Who can help us? Zena, what did you write in line B? Zena? So, Zena, hello, are you here? No. Dilara?
Yes, doctor. I'm here, but my Wi-Fi is lagging, so I entered at the end of the video. I couldn't answer this question.
I see. Dilara, what do you think of the second line? So the idea was just you need to, on the previous slide, so find out from the bed managers if any patients have been moved and where, to avoid wasting time. Yes, Dilara?
Looking for patients?
Yes, especially the consultants running around looking for patients. Yes. Okay. Well, the next line is for Bere. So the idea was check that all the case notes, investigations, and so on are on the ward. Bere. So.
Because they may be more knowing about.
You are speaking about D. Now C. Did you write anything in line C?
No, I didn't write.
Okay. So D is about the nurses, right?
Them quickly. C refer to them quickly.
Quickly, yes, the notes, so that you can.
That can.
Yes, refer to them quickly. Okay.
I think.
Yes, you're right. Esginur, what about D?
Thank you.
Esginur?
Yes, because they may be more knowledgeable about the patients on the wards.
Yes, this is about nurses. You should also invite a nurse. They may be more knowledgeable about the patients on the ward. Okay, and so now Mustafa, the last line here, please, Mustafa.
Record them clearly and concisely. In that way, you can access information easily.
Exactly, good. Yes, so these are the comments of a real doctor on the previous tips when so doctors and medical professionals go just ward round, go on a ward round.
Unit 3.
Yes. So I would also, yes, I would also ask you a question. Would you give the same tips to a junior colleague in this situation when a junior colleague goes on a ward round for the first time? Or can you give any additional advice? So what would you recommend to your junior colleague on a ward round? Zena?
Yes, doctor.
Can you answer the questions? So do you think these are good pieces of advice? Or can you add anything? Zena, are you here? So here are the tips. Can you add anything to these tips, Zena? Yes?
1 minute left.
Yes.
Yeah, I'm here.
Yes.
No, I think they're enough and accurate.
Okay, so Actually, you are not just you are not the doctors yet, and you don't have such much experience in a ward round. But I think these are the useful tips, just to remember everything and stay focused during the ward round. Well, now let us stop